of the standards. You stated that the CS had done, at one point, said that every county will have 2 testing centers, 1 testing center. I don't seem to remember when this was and when he stated that. But if indeed he did, then I think he was just expressing the aspiration of our program, our COVID response, to be able to get testing to the points where it's going to be needed, especially now that we have community transmission that is well embedded within the country and within the counties, health being a devolved function and a responsibility of the counties. It therefore makes sense that the counties also be enabled to be able to provide the appropriate response. So that is an aspiration that, of course, we would want to have, if it is possible to get their facilities working, because they do have labs. Most of the counties have functional labs. It is a matter of putting in the right tests and equipment to be able to do that. I think we have done quite a bit of work with the counties to capacitate a number of their facilities to be able to do these tests. The 28 facilities that are currently doing tests, quite a number of them are actually placed in the counties and are facilitated by the national government. So we will continue to support decentralization of testing and bringing the testing closer to the people, because, as you know, this test also that we use, the RT-PCR, has a turnaround time of about 4 to 5 hours. It makes sense, therefore, to get it down there where it can be done immediately and the results obtained in good time. We have talked about truckers and the problem with trucks at the border points and all of that. This is all part of that effort to try to get the tests closer to the people. Your second question was about the 300-bed capacity. This is a target that was set for the counties, I think jointly set by the national and county governments, to be able to achieve this level of capacity and prepare ourselves for the surge that we may likely see as we approach our peak. I can tell you that these 300 beds are not just simple beds. There is a proportion of them that are going to be set up as ICU beds, together with all the other supporting equipment that is required, the ventilators and other equipment, the monitors that will be required for those who are critically ill. This has been well thought out, and there will be a portion of these 300 beds in every county. In addition to their existing ICUs, we'll build up additional capacity for ICU to be able to handle those that we estimate, given our figures, will move into that category of those that are requiring support for breathing. NTV, I didn't know that Uganda was one of the countries that has been provided the permission for their nationals to travel to the EU, and Kenya, you tell me, you're informing me, is not on that list. That's what you're saying, isn't it? I don't think I can comment on that. I think this is something we will have to perhaps liaise with our Ministry of Foreign Affairs to find out what is at play here, whether this is a final determination or whether it is a preliminary list. So I will not be able to respond to that at this point in time. Khaemba, yours was about COVID-19 and TB, and you want to know how many of those fatalities that we have seen so far in the country died because of a combination of COVID and an underlying TB. This data is available. I don't have it right on hand, but it is available, and we'll dig out through this data. We should be able to respond to you and tell you how many of those fatalities were a result of COVID, of course, with an underlying condition of TB. Equally, you wanted to know how many comorbidities have we noted now where TB cases are also COVID positive. Again, that is data that is available, and we can get that data for you. Finally, Otieno of NTV. I would like you to repeat your question because I didn't really get it, but I think the essence of what you were saying is that there seems to be a new strain of the virus. Is that what you said in China?
Yeah, there seems to be a strain of the swine flu that has been described.
Swine flu?
Yeah, swine flu.
Okay.
In China, that has been described as being of a pandemic potential. So is the ministry aware of this, and should Kenyans be worried?
Well, anytime there is a pathogen that is deemed to be of pandemic level, of course it is a concern not only to Kenya, but every other country on the globe. Here we are in the midst of a COVID-19 pandemic. So any pathogen, and we know the swine flu, we know what the swine flu has done in the past, that information, of course, will need to be verified and backed up with evidence. But clearly, if it is a pointer to that, it is a matter of concern, and we should all be concerned. And the more the reason why it should be able to motivate us to strengthen our systems even further, because we know that COVID-19 is not going to be the last pandemic that we shall face. We will see other pandemics in the future. We don't know of what nature, but we must build our health systems. Our health systems must be resilient to be able to cope with any disease or any pandemic that is likely to come up in the future. And I think this is what COVID is teaching the entire world right now. COVID-19 is teaching the world that it is really all about having robust health systems that can cope with any eventuality if a pandemic does break out.